Hey everyone, welcome back to Medfoxes. This is part 2 of our discussion on pacing indications and introduction to pacing system in the Cardiac Pacemakers Beginner's Guide series. Let's continue where we left off and dive deeper into the pacing system.
Class 1 indication in case of AV block is symptomatic bradycardia, including those from arrhythmias and other medical conditions. Documented period of asystole for more or less 3 seconds with 3 seconds and the escape rate of less than 40 beats per minute in awake symptom-free patients. Post-junctional ablations um, uh, due to atrial fibrillations, the patient is going for the uncontrolled ventricular response. Usually, patient will go for the AV junctional ablation. In that situation, patient may end up in a third degree AV block, and post-operative AV block not expected to resolve. In addition to those listed, other indications for third degree block include neuromuscular diseases with AV block such as myotonic muscular dystrophy, Kerner-Sayre syndromes, herb dystrophy, and peroneal muscular atrophy. Second degree AV block, regardless of type or site of the block with associated symptomatic. Apart from the sinus node dysfunction and AV block, whether it's acquired or congenital, pacemaker is also indicated in case of neurocardiogenic syncope. The two most common manifestations of neurocardiogenic syncope are carotid sinus syndrome and vasovagal syncope. While the role of pacing in carotid sinus syndrome is fairly well established, the role of pacing in vasovagal syncope is subject to more debate. The other indications of pacemaker include hypersensitivity carotid sinus syndrome. It's a disease of carotid sinus, a dilated portion of carotid artery that has a pressure sensitive receptor that regulate heart rate and blood pressure. Carotid sinus syndrome is an extreme reflex response to carotid sinus stimulations, and usually results in bradycardia and or vasodilatations. It can be induced by, among other things, like a tight collar, shaving, head turning, exercise, and of course, carotid sinus massage. Carotid sinus syndrome is a class 1 indication for cardiac pacing. Recurrent syncope caused by carotid sinus stimulation, minimal carotid sinus pressure, induced a period of asystole more than 3 seconds in duration is a class 1 indications for cardiac pacing. So, in summary, pacemaker indications: symptomatic bradycardia due to sinus node dysfunction, AV block, type 2 a complete carotid sinus syndrome, and vasovagal. This I'm moving into the short introduction about the cardiac pacing system. A cardiac pacing system, a basic pacing system, is made up of implantable pulse generator that contains a power source, that is the battery within the pulse generator that generate the electrical impulse. The pulse generator also has a circuit which controls the pacemaker operations. The electrical impulses are transmitted from the battery or pulse generator to the cardiac tissue via leads. The leads are insulated wires that deliver electrical impulse from the pulse generator to the heart. These leads also transmit electrical impulse from the heart to the pulse generator. The leads consist of electrodes at the distal tip. These electrodes are conductor located at the end of the lead. It delivers the electrical impulse and pick the signals from the heart to the pulse generator. This will be used as a sensed electrical activities for the pacemakers. The pacemaker The pulse generator is a foreign device which completes its circuits in combined with the body tissue with the help of pulse generator, lead wires, cathode which is a negative electrode and anode which is a positive electrode and body tissue. The pulse generator consists of battery. This battery is made up of lithium iodide, the most commonly used power source for the today's pacemakers, and microprocessors, both ROM and RAM, and control sensing, output, telemetry, and diagnostic circuits. During pacing, the impulse begins from the pulse generator, follows through the lead and the cathode, that's a negative electrode, stimulating the heart, and return to the anode, that's a positive electrode. The pacing systems are generally divided into unipolar pacing system and bipolar pacing systems. A unipolar pacing system contains a lead with only one electrode that is within the heart that serves as a cathode, and pulse generator, that is the IPG, which is used as an anode, that is a positive electrode. In in bipolar system, the pulse generator, the lead contains two electrodes within the heart, that is the cathode and anode, which lies close between each other and within the heart itself. The distal tip is an cathode and the proximal electrode is an anode. The first documented attempt to stimulate the heart muscle in 1970 by the first implantable pacemakers developed in 1960 were asynchronous pacemakers, that is, pacing without regard of heart intrinsic rhythm, that is, intrinsic action, that is a VOO mode. Single chamber demand pacemakers were introduced in late 1960s. In 1979, the first dual chamber pacemakers that was in DVI mode was introduced, followed by closely 1981 release the first dual chamber pacemaker. The first single chamber rate responsive pacemakers was released in 1985. Today, dual chamber pacemakers uses rate responsive pacing to mimic the heart rate response to meet metabolic needs. Most recently, a combination of sensor to best accomplish this task. In the picture, you can see the one first implanted device. The device is coated with the epoxy materials, and the lower left you can see the model number as written something. So it's a VBI device with a titanium case. But nowadays, the most of the pulse generator is coming with the titanium case, and the middle one is a dual chamber pacemaker. The first dual chamber pacemaker, which is implanted by the Medtronics, I think so. And the lower right is a recent one, 1998. It's a Kappa 400, I guess. In today, multiple programmable rate adaptive dual chamber pacemakers with a wide array of lead systems and features. Over lot of pacemakers implanted worldwide every year. Approximately 17,000 pacemakers implanted in India every year. New advances in pacemaker therapy. These are the few new recent add-on to the pacemaker. That is the automatic adaptive pacemakers, minimization of ventricular pacing, tremendous amount of diagnostic information, MRI safe, leadless pacemaker, etc.
You've just completed another vital step in understanding cardiac pacing. Let's keep the momentum going. We'll be exploring more essential topics in rhythm management devices in the upcoming videos. And now it's your turn to check your progress. Head over to our website where we've built two assessment tools just for you: a knowledge assessment with 500 plus MCQs from the entire Beginner's Guide series, an IBHRE format exam simulation, consists of 5 blocks, 40 questions on each block, timed to help you sharpen your time management for the real exam. Whether you're studying for IBHRE, CCI, EHRA, or simply want to sharpen your clinical understanding, these assessments are your next step. Click the link in the description to get started now. If you're enjoying this series, like, share, and subscribe to Medfoxes. It really helps us grow and reach more learners. Thanks for watching, and I'll see you in the next one.